Welcome back to Personal PT. Today we're going to go over Achilles tendinopathy. Achilles tendinopathy is an ailment that affects a lot of the population. You might think, oh, it's only for runners or athletes who might get that Achilles pain, but as statistics show, it affects both active individuals as well as non-active and sedentary individuals. So it's a really important topic for us to go over. Regarding Achilles tendinopathy, I'd like to go over common treatment recommendations as well as how those principles can be applied to preventive strategies to prevent that Achilles pain from occurring. In order to do this, I have to use a little physical therapy lingo, so I apologize in advance, but we'll go over that first. So I want to review eccentric and concentric contractions. Eccentric contractions are commonly recommended for Achilles tendon treatment. So, a concentric and eccentric contraction. So concentric is when the muscle shortens, eccentric is when it lengthens. A lot of times we think of concentric when we're lifting weights at the gym or lifting up a gallon of milk. That muscle gets shorter, but as you lower that weight down, the muscle has to get longer. And it works not only the muscle fibers, but it is hypothesized that it works other elements that are really important to our body, like our tendons and other non-contractile elements that are really essential for us to work and are important for injury prevention. So the way that eccentric comes into play with Achilles tendinopathy is through heel drops. And I'll show you what those are. Now, before you start this, please, if you have any injuries on your ankle or foot or knee, go see a skilled health professional and get a diagnosis to see what the right treatment plan is for you. So heel drops. Seems like a simple exercise, but very effective. Just make sure you have a stair or a little ledge that you can drop your heels off of, and then a railing or something to support you. So we're going to start with our heels over the edge, and you're just going to slowly drop them down. And so as you drop them down, that muscle lengthens. That's why it's an eccentric contraction. And start with 10 repetitions if you want with both feet. And then as you start to work up your repetitions, you can start shifting your weight. So I'm going to work my right leg. I'm still putting a little weight in my left leg, but I'm using more of my right. And you really want to make sure that it's controlled as you go down. And then eventually, you can go down on one foot. Use the other foot to help you come back up and slowly drop down. Good. And then another option is to do it with your knees bent, because that works a different muscle. But just be cautious with these, because eccentric contractions, although they seem kind of easy and they're not working your heart load as much, they're not as cardiovascularly powerful, they work a lot of those structures that we don't normally work during the day. And there's more force and torque involved in these contractions. So you want to make sure that you start a little slower than you would normally. So if you're doing 3 sets of 10 sometimes at the gym, don't go and do 3 sets of 10 of these. Start with 1 set of 10 or 2 sets of 5. See how your body responds and what you can tolerate. And start at the lower level of both legs and then work on the weight shifts. And you want to make sure that you work on both sides to make sure that you stay balanced. Now, one other thing to think about with these, to complement them, especially on the preventative side, is if you're one of those active individuals, make sure you complement it with sport-specific training, specific drills that are appropriate for your sports. But if you're not as active or you don't have those goals and you want to stay healthy and comfortable, then make sure you incorporate lower extremity strengthening and some aerobic activity to get that cardiovascular component in your exercise program. So I hope that these tips will help your body stay happy and healthy and help you think about what you might want to incorporate into your program besides just the regular concentric contractions that we are normally accustomed to. Thanks so much. Have a great day, and here's physical therapy coming to you.